Здравствуйте. Сегодня мы
Hello.
поговорим об
Today we are going to
атопическом
talk about
Детей с
atopic
этим заболеванием
dermatitis.
становится с
The
каждым
amount of
годом
children
всё
suffering from
больше
this
и больше.
disease is increasing
Что
every year.
могут сделать родители,
What can parents do in
избежать
order to
заболевания?
prevent this
Как
illness?
помочь, если
How
появились
can you help if the
Поверь,
symptoms
вы можете
begin to appear?
очень много. Пойдемте,
Trust me,
будем
you can
учиться.
do a lot. Let's go and learn.
Програма виходить за підтримки
діти.
торгової
Hello,
марки
children.
Молфікс.
Здравствуйте,
Hello, my dear friends.
Здравствуйте, Луиза Васильевна.
Hello, Louisa.
Итак, у нас сегодня чрезвычайно актуальная тема, актуальная для огромного
Well, we have an
количества
extremely
семей, что
topical
особо
subject today.
приятно. Мне кажется, что именно сегодня
It's
мы
topical
действительно
for a great number of
сможем
families,
научить
and what is
очень
pleasant
многих
for me,
мам и
I
пап
believe that today we will be able to teach a lot of mothers and
помочь
fathers
своим детям.
how to help
Но
their
начнем
children.
мы с того, что узнаем, что думают по
We will
поводу
begin with what our
атопического
experts
дерматита
think
наши
about
опытные
atopic dermatitis. Dermatitis is when you have a lot of pimples everywhere. It's red spots that appear and then disappear. When your skin is bad, they come up. I don't have it now, but I had it when I ate at Aunt Ira's. I was like Santa. My skin was hot and red. Oh, I don't even want to look. It's when everything is covered with pimples. They're on your legs and everywhere. You need a medicine for it, but I don't know what. My friend had it too. He went to kindergarten and he had it over here, on his forearm, on his head. Some spots of red or black color. Then he didn't come. Even doctors didn't know what he had and couldn't heal him. But he's still alive. The most important thing, if you've noticed, is what our experts have told us about atopic dermatitis looks like. But they haven't named the main symptom. They showed it. They showed that it itches. The main symptom of atopic dermatitis, as a matter of fact, is itching. Skin itching and skin changes are very frequent symptoms in children. In general, the symptoms of atopic dermatitis, as a rule, the first symptoms happen under the age of 2 years. So if everything has been all right for your whole life, and then at the age of 20 you start itching, it's not atopic dermatitis. Atopic dermatitis appears under the age of 2 years. Nevertheless, there are a lot of questions. That's why pediatricians have to communicate with mothers very often. Am I right, Louisa? Indeed, you've had an appointment with a television producer, Ivanna Dediura. Let's look. Daddy and Mommy. From an early age, she's been working hard with her parents in the studio. But still, they somehow believe that she is too young to get a salary. Where's the fairness? Sophia should have asked. But today she's worried not about industry issues, but health problems. Cream, soap, and finger. That's why she came to see Dr. Komarovskiy.
София, иди ко мне, покажи свой несчастный пальчик.
Sophie, come here. Show me your poor finger. Here.
Да, это
Oh my
очень
God.
серьезная
This is a very serious allergic boo-boo. Mommy, we forgot to put some cream on it.
Вот. А эта тема...
This issue of atopic dermatitis, when did you first come across it?
Она впервые всплыла.
The first time I think it happened She's about 7 months old. We began complementary feeding.
When
We started to give her common foods, not only potatoes, but bright carrots, and tried to give egg yolk for the first time. Then suddenly it resulted in an allergic reaction. We didn't think that it was a disease. It came up as an allergy. And the doctor who came to us said, let's stop and remove all the bright products. So we did. Mom. Excellent, very beautiful. Build another one, please. We removed carrots. They said to remove cauliflower, removed everything, removed egg yolk completely. Even now, we don't eat it. Thank you. It seems we removed everything. It was gone. Then we again gave her a little. It all started again. Anyway, we are in misery and we are suffering. Indeed, you are. Because I feel sorry not to feed because child is conscious about it. So according to the mother's tone, this is not only the child who suffers, mother suffers even more seeing that everybody is eating. Yes. And you cannot give your child what you eat yourself, and she's begging for it. And she looks at you with a hungry look. I turned into a sadistic mother. The most terrible thing is to have food which you cannot give to your child. Yes. But when she was little, it didn't take such forms. Let's say threatening forms. Apparently, when food became more diverse, some other factors, the form of disease has become completely, even very painful, I can see. Moreover, it even came to cracks, especially on her hands. These types of disease regularly return in such form. Maybe it is caused by different time periods, seasons, for example. What else can it be? Look, you suggest when she was 8 months old that she had a food allergy. And you have been keeping your eye on it all the time. But the problem comes back despite your heightened vigilance. Yes, in this situation, logic and common sense tells us if problems come back so soon, moreover, they take relatively serious forms that bother the whole family and especially your child, especially if it itches, scratches. Itching is one of the main and most dangerous symptoms of atopic dermatitis. So if you have it, it means you cannot exclude the main factor that causes it. You apparently are taken up with food. In fact, it turns out that factors provoking atopic dermatitis are not just food, to put it mildly. The most important thing is skin condition. To be more exact, skin moisture loss. Dehydrated skin is a basic mechanism that makes skin cells sensitive to these very offending agents. Clear? So, if your child ran and sweated profusely and you failed to give her a drink in time, oh, really? Of course, not in time. So, she came home wet and sweaty, and you told her, first we'll have dinner, and then you'll have your favorite stewed fruit drink. So to say. It's not like that. Liquid loss is dehydration. Well, after jogging, your throat becomes parched. Can you feel it? Of course. And as for skin dehydration, you won't feel it all at once. You'll feel it at night when your skin starts itching. See? That's how it happens. At night, she's itching, and she always says, scratch me. And I, by the way, point out that the words itching, scratch me, are the most important in this disease. So if it's itching, you do not control it. Do you not understand? The most alarming symptom of atopic dermatitis is not the place where it appears, not how reddish it is, but where, whether there is itching or not. If your child wakes up at night and can't fall asleep, as he or she is itching, you need to turn to a doctor. Got it? It means you haven't solved the problem, but there is a problem. What is the reason for skin dehydration? The first one we've already mentioned. It's sweating, and the second one is indoor conditions. It's winter now. Yes. Tell me, please, Ivanna. It's warm at home, of course. Warm, that's the first. Of course, the second question is accompanying. What is the moisture of the air in the room your girl sleeps in? I don't know. Tell your father, a director who regularly shoots her in the movies and pays her nothing. So tell him to buy a thermometer and hydrometer on the saved money and place them in her room. Let him call plumbers who can install a valve on the radiator. Clear?
который поставит краник на батарею, понятно, да? Чтобы ее можно
Yes.
было прикрутить.
So what it can be measured. And again, you have to understand the factors that cause atopic dermatitis
Это те же факторы,
and the factors that cause other diseases, allergic rhinitis, bronchial asthma, are connected.
Это связанные факторы.
I don't want to scare you.
Я, наоборот, хочу
On the contrary, I want to point out your possibilities. Because either you stop scratching and start enjoying your life, or you will end up with something serious, with usage of serious medicine and a problem which will follow you throughout your life. Everything depends on you now.
А скажите, пожалуйста,
Tell me, please, is it age-related illness?
Это возрастное.
Yes, it is.
Очень часто.
And very often its symptoms start to decrease and decrease dramatically after 3 to 5 years of age.
Резко уменьшаться. Но
But I want to emphasize you don't have such a tendency. No?
Нет.
Нет.
No.
Вот когда
When you don't have this tendency by 3 years old, that means you cannot count that she will get over it fast.
Не надо очень
It
рассчитывать.
can change, in essence, in juvenile age, when the skin condition changes,
Это может принципиально измениться в подростковом
when the
возрасте.
condition of the oil glands and respiratory glands change.
Когда изменится
Yes, it can essentially change and this sickness will
это
pass.
может принципиально измениться, и тема покинет вас. Но может наоборот обостриться.
However, it can happen vice versa and the disease can get worse.
Ваше внимание на то, что
That's why
любой
I would like to
женщине,
draw your attention to the fact that any woman, if she wants to be attractive, white and fluffy for many years,
и чтобы окружающие ее мужчины ходили,
so that men can lick their lips when they seeing her,
очень
a woman
даже
should
не
look after her
помешает.
skin moisture.
Я вас уверяю, что Софиюшкина
And I can assure you that it will do no harm to Sophia's mother to sleep in a clean, cool, moist room and to warm herself with the help of father, for example. Nevertheless, we have already mentioned the most important thing, and I'm not sure that it's clear. I want to draw your attention to it once again. If we solve the problem of skin moisture, we will solve the problem of atopic dermatitis. Unfortunately, thousands and thousands of women are constantly experimenting with diets. Something they give, something they don't. They spend a lot of money on different expensive formulas trying to change the skin condition. Thousands of breastfeeding women lose conscious eating only bread and water just because they are sure that what they eat influences the fact whether their baby has atopic dermatitis or not. However, they cannot take in that no food, no medicine can change anything. If they don't change the main cause of atopic dermatitis, an issue of skin moisture. We are going to talk about it for the whole time today. I'm sure that you have a lot of questions. Let's start answering them.
Здравствуйте, Евгений Олегович.
Good afternoon, Dr. Komarovskiy. I have a question of such kind.
Это пищевая аллергия, да,
What if it is a food allergy, but it develops as atopic dermatitis?
Скажем так, все, что можно и не
Well,
можно.
we have already excluded everything that we can eat and not, but in fact, food removal helps. And if again we give food that causes allergic reaction, should we give it in small quantities? Should we refrain from it or give a little from time to time and when?
Времени как бы по чуть-чуть давать и какой период?
Я вас понимаю. Я прежде всего
I see what you mean.
ваше внимание на следующее.
And first of all, I want to point out that atopic dermatitis, I emphasize it, has nothing to do with the quality of food you eat. That's such a global delusion.
Глобальное заблуждение. То есть, если вы знаете,
So if you know that, let's say, you ate peanuts, afterwards your whole body was itching, that is a clear allergy. So you understand that you cannot eat peanuts, and likely never will be able to. However, if you hesitate, whether it is the reason or not, in fact, the symptoms normally appear during a 24-hour period after eating. And if after this period no symptoms appear, then this food doesn't cause an allergic reaction. And once again, I want to draw your attention. We, by the way, have touched upon this issue. If you remember, we started the School of Dr. Komarovskiy with a program about diathesis, and we discussed the same subject. And now we are going to revise that sweatiness, overfeeding, not bad food, but a lot of food, undue defecation, i.e. constipation, heat in the room, and what kind of causes? Contributory causes. In affecting them, we can substantially decrease the probability of atopic dermatitis. But when you tell me that we stopped giving it and it got better, can we give more? The first thing is to give not when it has gotten better, when it is all gone. I point out that you can experiment only with a healthy child. He has recovered it, and we wonder if his atopic dermatitis is connected with strawberry. So when he's recovered, you give him one berry and watch. If during the 24-hour period nothing comes up, that means it is not an allergic reaction to strawberries. However, if you give him a kilogram of strawberries, anything can happen. And this is the point. I want to focus your attention on what atopic dermatitis differs from allergic dermatitis, though it seems there is no difference. Doctors really understand what allergy is. If you are allergic to strawberries, it will be so for the rest of your life. As for atopic medicine cannot fully comprehend what it is connected with. There can be certain genetic factors, predisposing factors. Today, there might be a reaction to it, and in a month, might not. You cannot overgrow allergy. Well, you can overgrow atopic dermatitis. At the same time, you can drive the situation to a terrible state if you help wrong. Soon, we'll find out how to help properly. Thank you. Dr. Komarovskiy, please tell me, what can long-lasting atopic dermatitis cause? Well, you perfectly understand that if a baby doesn't have a good sleep for a long time, if he or she itches, scratches his or her skin, it results in damaged skin, which leads to bacterial inflammation, even to staphylococcus or fungus inflammation. Then your baby cannot move normally, cannot sleep well, he or she is constantly suffering, and on the place of scratches, scars appear. And this is a cosmetic defect, and so on and so forth. What frustrates me is that you do have real mechanisms that can help, and you do not know how to use them. Thank you. Hello, doctor. Could you please tell me if there are any methods for atopic dermatitis treatment? Well, so that I could tell you about the treatment, let me first draw you something. And this might be almost the most important thing. If you understand it now, you will be able to help your children. Here, look, this is normal skin. The external skin layer is called epidermis. Here are the skin cells. Over here, over the skin, there's a thin film called hydrolipid layer or hydrolipid film. It consists of fat, and over this film, people, I am explaining in very simple words, and maybe our great scientists will criticize us, but the most important thing for me is your understanding. And over here, we have water, drops of water, water molecules. So these molecules are connected with each other with the help of a certain substance. Let's call it X factor. This is the factor that can hold water. The amount of this factor holding the water is genetically inherited. So there are people who have a lot of it, hence skin is never dehydrated. And there are people who have little of it. Is it clear? Great. Now imagine another situation. What happens if the amount of this factor is poor? The same epidermis, the same cells. However, if water droplets don't join up and there's a little amount of this factor, then in this very lipid liquid layer, the holes can appear and harmful substances start affecting the skin. Through these holes, skin starts to lose water and becomes very sensitive to a lot of things. And now, let's think how we can neutralize this fat film. First of all, think about a thing that neutralizes fat and use it every day. Soap. Soap. Simple soap. It means that atopic dermatitis happens to a dirty child 10 times less than to a loving, clean, and full child. Is that clear? And now let's think of another option. The air is dry, then moisture loss is higher. And we live in the country where for how long the heating system lasts? Half a year. We all have gathered here, and we have fair-skinned kids here, and there, exactly, fair-skinned children have little of this factor. And we keep these children at school, kindergarten, home for half a year, no less than half of their lives in dry and warm air.
по полгода, минимум полжизни держим в сухом
And
и
since
теплом
they have skin
воздухе,
problems,
и поскольку у него с кожей проблемы,
we wash them with soap 5 times a day. Am I right?
А потом говорим,
And then we say, no
«Ну,
matter
наши
what food we
еды,
stop giving them, nothing
всё
helps.
не помогает. Мы
We
то
remove
не даем,
this,
и то не
that.
даем. Но
But should a
стоит
child come to his or her
приехать к
grandmother in the village,
деревню,
skin becomes normal in a
и
week.
кожа за неделю становится нормальной. И мы не можем сами понять,
We
что
cannot
меняется
understand
у
what
бабушки
changes
в
at
деревне.
grandmother's.
А у бабушки
In the
в
village, the
деревне
grandmother doesn't
нет
have a heating
радиатора
radiator.
отопления. Мы туда приехали тогда,
And when do we come
когда
there? When the
закончился
heating
кто?
season is over.
Отопительный сезон, да? И поэтому оказывается, что если
And
мы
it turns out that if we at least moisturize air in the room we live in, change the soap, or use it less
и
frequently,
поменяем мыло или реже будем им пользоваться, то
then
мы
we will
получим
receive a great
огромный
effect.
эффект. И это важнее
It's more important than all the
всех
medicine put
лекарств
together.
взятых. Пока это понятно?
Clear.
Понятно. Теперь,
So
когда
far,
мы примерно понимаем, из-за чего
Now,
это возникает,
when we roughly
давайте
understand the causes,
посмотрим
let's look at the major
основные
principles and methods of
принципы,
atopic dermatitis
способы
treatment.
лечения атопического дерматита. Я обращаю ваше внимание,
It's important to note that treatment begins with the removal of the trigger factors. Treatment will bring no results unless these factors are
Если
removed.
мы эти факторы не устраняем, будем лечиться без результата.
And here is a question. Can a doctor remove trigger factors? Can a doctor moisturize air in your
Может
room?
врач вам увлажнить комнату,
Can a doctor wash your baby
правильно
properly
помыть ребенка,
or dress your baby in
дать
cotton
ему
clothes that don't rub
одежду
against
из
his or her
хлопка,
skin, isn't
которая
tight,
не
which is
трёт,
washed
не жмёт,
correctly,
не давит,
rinsed intensively?
которая правильно стирается, которая интенсивно полощется.
A doctor
Не
cannot do
может
that.
это врач.
The next thing is supportive care.
Поддерживающее лечение.
Supportive care is skin moisturizing.
Это увлажнение.
It means we cannot remove
Если
the
мы не
triggers. In the end,
можем
it is
устранить
very
факторы,
difficult to provide
в конце концов,
a
очень
proper air
трудно
humidity
зимой
everywhere in the
полгода
winter.
обеспечить нормальную
We can
влажность
create
везде.
proper air
Вы
humidity in the
можете,
room the
конечно,
child sleeps
сделать
in, but there are
нормальную
such
влажность
places
в
like
комнате, где
kindergarten,
спит ваш ребенок,
school,
но
where
детский
air is
сад,
not to the standard and
школа,
nobody wants to
всё
deal
это
with it.
остаются места, где воздух абсолютно не соответствует нормам.
That's
и
why we
никто
still
не
need to
знает о них.
support the therapy,
Поэтому
i.e., to moisturize skin with different
поддерживать терапию, то есть
medications.
увлажнять кожу
We'll talk about it
различными
later.
препаратами, о них мы еще расскажем. Надо все равно. Дальше. Основа лечения,
Next,
уже
the
лечение
basis for treatment,
препаратами,
medical treatment, is the
является
medicine
препараты,
called
которые
topical
называются местные кортикостероиды,
corticosteroid.
то есть
In other words,
противовоспалительные
topical
гормоны местного действия.
anti-inflammatory
Кроме них,
hormone.
в особых
Except this, in
случаях,
special
на самом деле,
cases,
еще раз
there are other
устранили
medications. Once again, I focus your attention that if you remove
увлажнили
trigger
кожу,
factors,
убрали
moisturize
симптомы
skin,
местными
get rid of symptoms with the help of
corticosteroidами,
topical
это
corticosteroid,
помогает
you'll help
98%
98% of children.
Но только
I
фиксирование
point out this.
алгоритм действий. Именно
This is
так
just the
я
algorithm of
последовательность.
treatment.
Не намазали
Exactly in this
гормоном, а
sequence.
забыли.
You don't just apply a hormone, then forget about everything else. But you remove trigger factor, moisturize skin, apply topical steroids, and then you get a result. I repeat, in 98% of cases, there is no need for diets, any silly things, torturing your child, stuffing him or her with lots of medicines, or doing lots of tests to get a result. However, if it doesn't help, in some cases, they use other medicines, certain antihistamines, some types of sorbents, and some other medicines called topical and general immunomodulators, except that sometimes ultraviolet irradiation is used. Generally speaking, this is it. Naturally, there can be treatment of complications. Should staph infection happen, we treat it with antibiotics, both general and topical, and so on. In any case, under whose supervision is this treatment carried out? Pediatricians. By the way, not dermatologists. Atopic dermatitis is the problem any pediatrician faces with daily. And the treatment of atopic dermatitis is the main duty of any pediatrician and any family doctor.
Добрый день, Евгения.
Good afternoon, Dr.
Скажите, пожалуйста,
Komarovskiy.
есть
Could you
связь между
please
атопическим
tell me
дерматитом
if there
и
is a difference
современным
between
дерматитом?
atopic dermatitis
Потому
and
что нам педиатр
seborrheic?
сказала, что это
Because the
атопический
pediatrician says that we have
дерматит,
atopic
дерматолог сказал,
dermatitis,
что
and the
это,
dermatologist claims that we have seborrheic. Atopic dermatitis is absolutely specific symptoms. It is almost impossible to mix it up with anything else. Atopic dermatitis, for you to understand, is a combination of itching, redness, and inflammation of skin. Where can it happen? In the places where skin is very thin.
где она
as a rule, in body
в тех
folds,
местах, где самая
flexor
тонкая
surfaces.
кожа, как
However,
правило, в складках, да, на внутренних поверхностях. Ну, исключение, кстати, если
there
ваш
can be an
ребенок
exception if your child is Afro-Ukrainian.
У чернокожих детей обратная
Black children have the
реакция,
opposite reaction. They have it on the extensor surfaces, but the vast majority of Ukrainian children have their flexor surfaces and face affected with atopic dermatitis.
Или лицо, да? Дальше.
Okay, next. These symptoms can appear during the first 2 years of life. If the first 2 years of life, they appear on the face or flexor surfaces and there's itching, stop showing off your knowledge.
Не надо умничать. Это
It's atopic dermatitis.
Лечение атопического
Treatment of
дерматита
atopic dermatitis is not the art of a specific Mrs. Smith. It's a protocol
это протокол, известный врачам
known
всего
to
мира
doctors all over the world, which is
и
effective in
эффективный
98% of
в
cases. Is it clear?
98% случаев. Понимаете? Поэтому крайне маловероятно,
It's unlikely
что
that your
ваш
child is one of the
ребенок попадает
2%.
вот в эти 2%, понятно? Поэтому вам надо просто
That's why you
найти
need to find a
доктора,
doctor who knows what?
который знает, что
Protocol.
То есть не надо умничать.
Don't be
Понимаете?
smart.
Есть методы лечения.
There are highly effective
Мы
treatment
сегодня
methods.
всем о них
We will
расскажем.
tell you about them today.
Здравствуйте, скажите,
Hello,
пожалуйста,
doctor.
вот
Our child has been troubled with itching. I noticed that there is a light redness in his elbow joints, but more often he has a rash on his back. I understand that it happens when he is sweating. He is almost naked at home. I avoid any needless clothes and so on. I like to bathe him every evening. Am I doing it right? Water dehydrates the skin, doesn't it?
Люблю его каждый вечер купать. Правильно ли я делаю? Потому что вода же тоже пересушивает
А вот
кожу.
давайте тогда и начнем, и сейчас все
Let's start
внимание,
now.
да, вот все.
Attention
Мы
to everyone.
рассказываем самый главный способ
We're
лечения.
going to tell you the
который
main
никогда
method of treatment,
не
which no
сделает
doctor
вас
will
ни
do
один
for you.
врач. Вы, точнее папа,
You,
взял
to be
себя
more
в руки
precise, the father
и
must
устранил
pull yourself together and remove the
провоцирующие
precipitating factors.
Он разобрался с температурой
He must
влажности
deal
в
with
комнате,
temperature and humidity in the
он поставил
room.
краник на батарею,
He must
он
install a valve on the
заработал на
radiator. He
нормальную
must earn some
хлопчатобумажную
money for good
одежду
cotton
и так
clothes,
далее, и так далее.
etc.
Дальше. Начинаем то, что делает
Then we start
мама.
with what the mother should do.
Мама.
Mother is in charge of supportive care, i.e. skin moisturizing.
Вот теперь как мама,
And now,
вы
how can a mother, for example, moisturize the baby's skin?
Для увлажнения кожи
For skin moisturizing, we can use special medications, hygienic ones, called a very smart word, emollient.
словом эмолленты. Вот это слово.
Here is this word, emollient.
Каждая мама записала.
Every mother should write it down. Naturally, I cannot let myself pronounce the commercial names of emollients.
Произнести коммерческие названия эмоллентов. Я могу
I
только
can only
сказать,
say that if
что
you live in
если
extreme
вы
poverty,
живете в
even
полной
this situation,
нищете, в полной, то даже в этой ситуации вы
you
можете
can use the
использовать
simplest and
самый
very affordable
простой
emollient that is called
доступный
Vaseline.
эмоллент, который называется словом вазелин. Хотя есть
Although there are
препараты намного
much more
более
effective medicines.
эффективные. Итак, кто такие эмолленты? Это вещества, они бывают
So what is
разные.
emollient?
Задача
This is a
которых
substance. It can be
сохранить
various things.
влагу
Its
в
task
коже.
is to hold water
Вот
in
вы
skin.
сегодня, если у вас атопический дерматит, в интернете
If you have atopic
набрали
dermatitis,
слово эмолленты,
today you
купите
should
в
type
моем
and look
городе.
up in the internet the
И
words
посмотрели
emollient,
список.
buy in
И
my city,
почитали, что
and
они
study the whole
стоят.
list.
И сравнили
Read about
цены.
them.
И
Compare the
посмотрели
prices.
объем. И
Look at the
изучили
size.
внимательно эту тему и остановились на
Study
конкретном
this
препарате.
subject
Я
thoroughly
еще раз
and
фиксирую
choose a
внимание.
specific medication. I point out once again, emollients don't moisturize the skin.
Они не дают
They
коже
prevent it from losing water.
потерять жидкость. Поэтому наносить эмолленты
So
надо
what
на
kind of
какую
skin
кожу?
do you need to apply emollient to?
Увлажненную, да?
On
Теперь
moisturized
скажите,
skin.
пожалуйста, когда у ребенка
Now tell me,
кожа
please, when is the child's skin
максимально
moisturized most?
увлажненная? Тогда, когда вы достаете его
Just
из
after a
ванны,
bath, isn't it?
правда? Это должна быть ванна.
It must be a bath with moderately warm water.
Водой. Ну,
Let's
допустим,
say 30,
32,
33 degrees.
Не надо
That's
купаться
first.
более 10
Don't
минут.
bathe him more than 10 minutes.
Потом мы достаем
Then you can
ребенка
take him out of the
из
bath. God
ванны.
forbid,
И
rub him
очень
intensely.
интенсивно его вытирать. Мы его так бегленько промокнули.
You just lightly wipe him with a towel.
Теперь
It's time to apply the
самое время, не
emollient.
откладывая, нанести на него эмоллент. Теперь я вам расскажу, как наши
Now I will
мамы,
tell you how our mothers put cream on their babies.
они берут вот так вот на кончик пальца,
They take some of it on the tip of the finger and spread it on the whole back.
Пальца на всю спину они будут размазывать. Так вот, услышьте меня все. Норма
So please hear me. A dose of emollient for a baby is 250 to 500 milliliters a week.
500 миллилитров в неделю. Услышали, мамочки?
Have you understood it, mothers? A baby just like yours must get at least 1 liter of this cream per month. So if you brought a 100 milliliter tube of cream and had thought whether it's expensive or whether you can afford it or not, what am I driving at?
Дорогой он или нет, и потяну. Это я к чему, что когда вы будете, девочки, покупать, то вы же смотрите, потому что если вы купите...
When you ladies buy a cream, look careful. Because if you buy a 100-gram tube, what are you going to moisturize then? Is it clear? The father's brain. That's why common emollients are released and sold in the tubes of 500 milliliters and 1 liter. Because you don't need to spare it. That's first. Besides, you always must have a small tube after hand washing, face washing. What do you need to do? Apply a cream. Keep this in mind. I promise you, if you remove trigger factors and moisturize skin at least once a day after a bath, then 2 months later, you will have absolutely clean skin with a 98% guarantee. That's why we think it over and do it. It's not difficult. And I emphasize that even if everything is gone, but your child is fair-skinned and fair-haired, who can't sit still, who is sweating, then how do you need to use these medications? To treat supportively. Of course, not half a liter a week, but 100 grams. No way around it. When can you stop using it? When the heating system is over. Hence, the main trigger factor is removed. The air is humid, and you can live without emollients for the next 6 months. However, as soon as the heating season starts, we already have a valve on the radiator, humidifier, and supply of emollients for a long, long winter. Thank you very much. Doctor, are these medications only for children? No, Louisa. There are medications for children and for grown-ups. I've already focused on the fact that if women want to be nice and beautiful for a long time, they need to take care of their skin. What does an average Ukrainian woman do for half a year? She lives in a place with dry, warm air. And then by the age of 35, she loses her attraction, which is wrong. If a woman understands in what conditions she should live, she must demand from her husband to provide her with the conditions under which she will be able to stay nice and beautiful till her ripe old age. Dr. Komarovskiy, is it true that sunbathing can relieve symptoms of atopic dermatitis? Folks, we already mentioned ultraviolet irradiation is one of the possible treatment methods. Indeed, from time immemorial, it was noticed that ultraviolet rays ease the course of atopic dermatitis. However, I point out this method of treatment is never recommended by doctors because it has been proven that the benefit ultraviolet is less than the theoretical possible harm. Ultraviolet that affects infected, inflamed skin is one of the key factors increasing the risk of oncological diseases. That's why these methods are not recommended. I do understand that if a child with atopic dermatitis is running in the sun for 15 minutes a day before 10 a.m. in the summer, there'll be nothing wrong with him. But unfortunately, if I tell mothers that their kids can lie in the sun, they will lie in the sun for 2 hours from 12 to 2 p.m. Bottoms up on the beach. That's why we must not do that.
Програма виходить за підтримки торгової марки Molfix.
Здравствуйте, доктор. Скажите, пожалуйста,
Hello, doctor. What other medications can we use apart from moisturizing creams? And how can we use them? Well, the main remedies we are talking about are the remedies, as a rule, prescribed by a doctor. They are topical corticosteroids. In other words, inflammatory hormones that are the basis of the medical treatment. Yes, the mother can moisturize skin, though a doctor advises it. The father can remove the trigger factors, but only a doctor can prescribe you corticosteroids. The thing is that everybody has a lot of doubts whether to apply them or not. Therefore, the main thing is that you need to understand this is the basis of your attitude to hormones prescription for atopic dermatitis. The benefit of local corticosteroids, when used properly, considerably outweigh any possible risk. It's up to you. Doctors theoretically should know it to learn what is the proper appliance of corticosteroids So proper appliance. By the way, while we haven't gone too far from emollient, when you finished bathing your baby, there comes a question. What are we going to apply first, topical corticosteroid or emollient? First, we apply topical corticosteroid so that it contacts with inflamed skin, and then we apply emollient. In that way, we will be completely ready. And still concerning the rules, you must know that there are a lot of these medicines, topical corticosteroid. There are about 100 commercial varieties. As for chemical varieties, there are about 50. 50. All the medications are topical hormones, which are classified into 7 groups, depending on the strength. There are least potent, mid-strength, and super potent. The main rule is the correspondence of strength class with the severity of the disease. If it is a light form of the disease, then use a mild or least potent. If it's a middle, then use mid-strength. If it's severe, then use super potent medication. No wonder that, for example, one of the least potent medications is 1% hydrocortisone ointment, which is an OTC medicine even in these countries where you can't buy iodine without a prescription. So it only goes to show that this medicine is absolutely safe. We continue. We treat only new appearance of skin rash. That means if this rash is more than 2 days, you don't apply any remedy, but you treat new one, or the one that got worse, that became reddish and itchy. Next, the remedy is applied not more than 2 times a day. And now one very important rule. On the face and neck, you can apply a medicine of low strength. That's why, as a rule, if the problems are all over the body, doctor prescribes several medications, mild and mid-strength, for example. Mild is prescribed for the face, neck, body folds. As for other places, the one with higher strength class. Okay, the next one. By the way of exception, you can apply mid-strength medicine on the face and neck, but no longer than for 5 days. As for body folds, mid-strength or high strength are used for 2 weeks at most. And the last rule, medications of high strength class are used only after the doctor's prescription. These are the main rules of corticosteroid use. Is that clear? Once again, I want to make it clear. If prevention and moisturizing are not enough, who can choose the medicine? A doctor. Your task is to do your part. Then a doctor will be able to help you. I sincerely wish you quiet nights so that nobody will be bothered with itching. See you.